This is a very common question in NHS interview. Watch till the end. Make sure you learn. The use of News2 score chart is a new school scoring system. So anything above the normal values are scored. So the normal respiratory rate is 12 to 20 cycle per minute. The normal SpO2 rate is greater than 96%. There are some people that they are 88 to 92%. For instance, if a patient has COPD, chronic obstructive pulmonary diseases, don't worry about that. So blood pressure, if the patient's blood pressure is lower than this value, the patient will be scored. If the temperature too is lower than, is above or below 36.1 to 38.0, it will be scored. So now, when you say, I know how to check observation and I understand the News2 chart, it simply means that you know that, for instance, you check a patient respiratory rate now and you get between 21 to 24, this person is scoring 2. Everybody is supposed to score 0, right? For instance, if you check the person's blood pressure and you saw 220, you say the person is scored 3. That way, the doctors, the nurses will understand the urgency, and there is a way of attending to patients depending on the score. Normal is 0 to 2, but if a patient scores 3 in one particular one, for instance, every other thing is fine, but the respiratory rate is 25. Patient scores 3 in one box, you will need to alert. So whenever you are writing your application or talking in your interview, you say, I understand, I can check the vital signs, and I understand the use of the News2 chart, and I escalate appropriately with it. God bless you.